Welcome to VerifiedRx, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Chemotherapy is a vital treatment for cancer patients, but high medication prices often cause issues and may even prompt patients to skip therapy. Various factors influence the cost of chemotherapy drugs, including research and development, manufacturing complexity, and regulatory compliance. Limited use indications further complicate the market. Here today to talk about it is Dr. Michele Rice, Senior Pharmacy Executive with Vizient. I'm Gretchen Brummel, your program host. Michele, welcome to the podcast.
Thank you for inviting me.
Tell us about your background and role at Vizient.
I've been at Vizient for about 10 years now. I work as the oncology subject matter expert for the clinical pharmacy consulting team, directly with our hospital system members to optimize their infusions and cancer centers, bringing up a level of quality and efficiency wherever possible with cost saving. Part of my oncology career has been all about wearing the different hats that are available. I worked for about 10 years in a physician office setting, a very large cancer center system in central Illinois with private physicians. Before that, for about 6 years as the oncology pharmacist for a small community hospital with a cancer center. I've gotten to see the different treatment and billing settings and very familiar with the cost of treatment.
So you've seen and done a lot in the oncology space, and we're definitely glad to have you here as our oncology expert at Vizient. Lifetime risk of developing cancer is somewhere around 40%. So this impacts a lot of folks. A diagnosis of cancer can be devastating, and we know patients are dealing with a lot. What's happening in the industry right now?
The healthcare industry is more complex than ever. It's being influenced by a lot of factors beyond the traditional supply and demand economics that we think of in other industries. Factors such as government regulations, pricing negotiations, cost effectiveness, and changing technology impact the pricing and accessibility of chemotherapy drugs. This presents a big problem for the American employment-based health insurance system, with both positive and negative impacts on advances in chemotherapy. The system provides some financial resources and incentives for innovation, but really contributes to the fragmentation of our system and a lot of variation in coverage. Patients are challenged by affordability, and that influences treatment decisions. Imagine what work you would put into an important, expensive decision in your household, such as buying a car for your family. You'd assess your budget, talk about your needs and priorities specific to your family, and eventually select a vehicle based on cost. Now imagine if the whole job of selecting a vehicle, committing to terms for payment, and all of that decision was taken out of your hands and made by someone you've never met. Say in the HR department of your corporate headquarters or elsewhere. You'd have no input because all that work was finalized before you even knew you needed a car, which is what they call a plan document, where the rules of insurance are kept. And that's how the current healthcare system works and what you're entitled to. The insurance plan document isn't usually something that the consumer directly shops for.
So if I'm hearing you correctly, the consumer really isn't as included in the decision as they would be, for example, when they're purchasing a car.
Exactly. The consumer is not the patient. The employer purchases the plan, and they're considered to be the customer of the insurance plan.
So then how does this ultimately impact the patient?
There's an inherent asymmetry of information that impacts patients' ability to make informed decisions. The average American's health literacy doesn't align with the complexity of the treatment that they're facing. And that's not just a matter of science literacy or medical literacy, but how complicated and how technical some of the regulations are around these things and how complicated the plan document can be. Most people do not have the background to make sense of the differences between different treatments. And I'm not sure I do. All of the factors that are involved are not always available to the health provider either. Along with innovation, every single area in healthcare becomes more highly specialized. Patients often lack comprehensive knowledge of their own insurance policy, what their coverage limitations are, and how reimbursement works. Their cancer diagnosis is probably their first adventure into the world of medical billing and reimbursement. And that leads to surprises and misunderstandings in seeking services and results in challenges in accessing necessary care and managing out-of-pocket costs. Finally, patients have limited to no direct involvement in the design and negotiation of their insurance plans. Most people think of themselves as is a good consumer doing their homework about most things. But of all the important things you purchase, the individuals have almost no input into their health plan. You don't really have a reason to know that much about it until you're in that situation to find out what's covered, what's not covered. And by then it's already way too late to pick something else.
So it's almost like a trifecta for disaster with that lack of line of sight, the lack of autonomy, and the potential lack of healthcare medical literacy associated with this. And I can see with the increase in innovation, the increase in difficulty in navigating the system as well. So thank you for bringing up those points. How can pharmacists help come to the rescue to assist patients with this difficult to navigate scenario or situation?
Pharmacists are uniquely positioned to collaborate with patients and the healthcare team to help investigate those treatment decisions and what equivalents might be covered. We can also help with providing the documentation necessary to get the prior authorization, particularly for unusual diagnoses or treatments where the health insurance company doesn't have expertise in that area. And if not enough information is submitted with the claim and that prior authorization might be rejected and an inferior treatment might be chosen, it's critical to have all of the information ahead of time. Pharmacists can advocate for specific healthcare needs by proactively engaging with patients and finding out those needs and helping them navigate the potential coverage gaps or limitations that they might not even have recognized yet.
I'm really thankful we have pharmacists out there advocating for patients in that really challenging to navigate space. What do you want patients to know about the issue?
Above all, patients need to know they're not alone. They're not the first person in the situation, and no one plans to have a catastrophic illness or injury. Consequently, there's going to be aspects of your health plan that go unexamined until they're needed. If you're aware of that, you can ask the questions that are able to help you. Be sure to ask what resources are available at every step. Insurance companies often use care coordinators who can be assigned to keep answering your questions so you get the same person every time. Health systems often have patient navigators or patient advocates to assist with all of the complicated appointments that need to be made in the right order and records that need to be available in the physician's hand when it's needed. And above all, talk to your pharmacist in every setting in which you encounter them. They can help you seek prior authorizations, financial assistance programs for medications, and even help with coverage appeals when necessary. Communication is the key. They aren't going to just get involved in your financial business unless you ask.
Fantastic advice and good places to look for help when you need it. So if you were given a magic wand, how would you improve the system? What would be some of your major targets?
Gretchen, that would be another podcast series, a great topic. It's really difficult to talk about redesigning healthcare without getting political. Ultimately, we need more transparency to inform decision-making. That's necessary from the health plan, employers, and patients should be able to elicit feedback as to what they really want in a health plan and learn as much about it as possible, particularly after a serious diagnosis.
Well, it's good to have something to look forward to, and I'm glad to hear that there is some hope for improving the system. So how does the future look? What is the hope for improvement?
Oh, there's so many exciting advancements in store that can have the potential to revolutionize how we prevent, diagnose, and treat diseases. Our key challenge as pharmacists is to make sure the advancements can be accessed universally and equitably by patients without the financial toxicity that's often experienced today. And that's never been more apparent than in the recent approvals of several gene therapies with 7-figure price tags.
Well, Michele, thank you so much for joining us. Your insights have been invaluable.
Thank you for having me.
And listeners, please join us for more VerifiedRx podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. VerifiedRx is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.